If you're over 50 and your knee pain keeps coming back no matter what you try, there's a very good chance you're treating the wrong problem. Because here's the truth most people never hear. Your knee might not actually be the cause of your pain. And until you fix what's really behind it, that pain will keep returning. You rest it, it feels better. You walk again, it flares up. You try exercises, maybe even medication, and for a while it improves, but then it comes right back. And at some point you start wondering, is this just aging? Is this arthritis? But here's something surprising. Studies show that most people over 50 have changes in their knees on scans, and many of them have zero pain. So if wear and tear was the real cause, why isn't everyone in pain? Because the knee is often the victim, not the problem. Your knee is part of a chain, and if something above it or below it isn't working properly, the knee takes the stress. So today, I'm going to show you the 3 hidden problems that cause knee pain to keep coming back and how to fix each one. Problem number 1, weak hips or glutes. The first problem is hidden up in your hips, specifically a muscle called the glute medius. This muscle controls how your thigh moves. And guess what sits right below your thigh? Your knee. If your hips aren't stable, your knee has to absorb that extra movement. Over time, that creates irritation, pressure, and pain. Think of it like a door that isn't aligned properly. Every time it opens, it strains the hinges. Eventually, those hinges start to wear out. That's your knee. Exercise number 1. Here's a simple way to fix it. Lie on your side, keep your body in a straight line, and lift your top leg slightly up and a little back, not too high. You should feel it working right here, just under your belt line. If you feel it in your lower back, you've gone too far. Do 10 to 15 reps, 3 sets, 3 times per week. Problem number 2, stiff ankles. Now, even if your hips are strong, your knee still won't feel right if this next area is restricted, your ankles. Losing just a few degrees of ankle mobility, especially a movement called dorsiflexion, can increase your risk of knee pain dramatically. Why? Because your knee needs to move forward over your toes when you walk, squat, or climb stairs. If your ankle can't allow that, your knee compensates. Exercise number 2. Here's what to do. Place one foot on a chair. Keep your heel down. Slowly drive your knee forward over your toes, then come back. You should feel a stretch in your ankle or calf. 1 second forward, 1 second back. Do 20 to 30 reps on each side. Problem number 3, limited hip rotation. The final piece of the puzzle brings us back to your hips, but this time it's not about strength, it's about mobility. If your hip can't rotate properly, your knee is forced to rotate instead, and your knee is not designed for that. That's when irritation builds up over time. Exercise number 3. Here's a simple movement called the reverse clam. Lie on your side with your knees bent. Keep your knees together and lift your top foot up. Pause, then lower it slowly. Even a small movement is enough. You're not chasing range, you're building control. Do 10 to 20 reps, 3 sets, 3 times per week. So if your knee pain keeps coming back, don't just treat the knee, fix the chain. Strengthen your hips, improve your ankle mobility, restore hip rotation. Because when those 3 things start working together, your knee finally gets the support it needs. And that's when the pain stops coming back. And if you want to keep moving strong, stable, and pain-free as you age, check out the next video on your screen.